Yeah, so I've got a separate slide. We'll chat about, when we break into our specific programs, and we'll chat a little bit around the physio-specific stuff. But just to say that we have rotations based out here at the Rural Clinical School. So for the physio students, we have your community rotation, which is shared between Worcester, 2 sets of students that are placed in Worcester, sets of students that are placed in Robertson, and students that are placed in Ceres. So that's the community rotation. And your community rotation is just a really different look at the role of physiotherapy and looking at community-based rehabilitation, where you get unique opportunities to understand the influence of context, I think, on healthcare. When you guys will do home visits and you'll work with carers and you'll work in residential facilities, just to understand your role a little bit more and to develop a greater sense of professional identity. So it's a really cool opportunity. So that's your community-based rotation. And then around there's a neuro rotation that happens, that's set up here in Worcester. And the opportunities there are around attending ward rounds at Worcester Hospital and participating in the multidisciplinary team. Sorry, with the community, just to go back to collaborative care, just to bring that up, I think that's a really important thing, the collaborative discussions that you guys will participate in. That's a formal activity that's associated with the placement. And then around neuro, you'll be based predominantly at hospice, which is at Bellsgrove Hospital, where we actually have a set up step-down facility or step-down arrangement where patients are admitted for 6 weeks for intensive rehab. So you'll work closely with those patients. There's an opportunity for outreach, and we're based at Avian Park, at the container in Avian Park, so on a primary care level, providing one-to-one rehab in Avian Park. And then Hayes Ebenezer, which is a residential facility, and supporting carers and supporting and performing one-to-one treatments in that environment. And then our pediatrics block gives you a unique opportunity or exposure around creches, so supporting creche workers and supporting carers in the creche work facility. Early childhood development and developing your developmental screening abilities, where you guys will work in a primary care clinic and also in residential facilities. So those are the big things that are based out here in Worcester. And then just to add to that is our recently developed block in Uppington, which I think is quite exciting. So it's been listed as a special interest block, and the idea around Uppington is that the title of the block is Understanding the Role of the Physiotherapist in the District Health System. And it's kind of built on 3 pillars, which we think are critical, and that the clinical team in Uppington has helped us to develop and think are critical to a functioning rehab department in the district health system. And those 3 pillars are multidisciplinary team and interprofessional engagement. So really unique opportunities to participate in shared sessions where you'll manage patients together and academic ward rounds. So yeah, that's the multidisciplinary part. Continuity of care. We know that continuity of care is a really critical aspect to functioning well in the district health system. So understanding what the referral processes are, what the referral policies are, and looking at the gap between the hospital and the district outreach team, and understanding how that sort of functions and that relationship. And the last thing is alternative service delivery models. So looking at how do we, in a resource-constrained environment, increase our service delivery reach. And those are the 3 pillars that block is based on. So we have our first group of students returning next week, where we'll unpack it and unpack their experience and reflect on that. So those are the unique opportunities for the physio students at the Rural Clinical School.